Hello, everybody.
Hi, Dr. Saunders.
Thanks for having me.
I just want to say thank you so much for joining us today. My group, we mostly consist of a lot of parents and that use HBOT for a range of symptoms. So Dr. Jason Saunders and his wife Melissa are the owners of New Jersey HBOT and HBOT USA, and you guys are also the co-owners of a family wellness center in New Jersey.
That's right.
Could you tell the listeners a little bit about your clinic and how you use HBOT for children?
Sure. Yeah. So our main clinic, or the place we started was in New Jersey. So it's in Florham Park, New Jersey. We also helped open another center outside Philadelphia and Pennsylvania. So, and we use, in both places, in both centers, we use a multitude of therapies. I love hyperbaric. I think it's an amazing therapy. I know you had a lot of, really good results with Denise. And so helping to educate people on that topic is just really exciting for me, because I think there's still so much misunderstanding and misconceptions and myths around it that, anytime I have a chance to clarify any of that stuff, I really, I'd love to do that. And so, so we use, functional medicine. We do a lot of nutritional work. We do different supplementation. We also have other practitioners in our clinic that do different things. So we have, someone who specializes in functional neurology, functional medicine, and then, a few docs that specialize a little bit more in like prenatal and postpartum type care, a lot of pediatric care. So, we offer quite a few different types of docs, as well as, different modalities, because as you know, too, every family, every child, every adult who has, whatever you're trying to help, they all have their own series of reasons and ways that, things became the way that they did. And so, there's no protocol in most cases, like, oh, do this step, then this, then this. It's, we have to find our way using, the best information.
Okay, yeah, no, definitely. I started using HBOT. My daughter suffered an anoxic brain injury about 3 years ago, and we did a lot of just basic insurance paid therapies from physical therapy, and nothing was really working after a while. It was a lot of managing the symptoms. And we started off with mild HBOT, very low pressure, but there was a lot of talk about, do you need a hard chamber? Do you need a soft chamber? Well, the results I saw just with using mild pressure were huge. I know after the 50th dive we took, it was the first time my daughter ever sat up by herself after her brain injury. And that for us was just huge, because I didn't know if that would happen. I know you treat a lot of kids with autism and brain injuries. I was wondering if you could tell people too about some of the results maybe you've seen in your clinic relating to brain injuries, or even just to autism or other symptoms.
Sure. I mean, and if you want, we can dissect, very specific, categories within that. But for now, I'll just talk, broadly to say that in so many ways, there are certain foundational raw materials that our bodies require for healing and for function. And oxygen happens to be one of those raw materials that it's just such a critical component of that healing process. And so we do a lot of TBI and concussion, different types of traumatic brain injury, from whether it's from birth or an anoxic injury, even later on. So CP, autism, like you were mentioning. So, the results that we see, they vary tremendously, as you can imagine. And they also have a lot to do with what symptoms, or what area of the brain are obviously affected. In autism, so often the language centers are affected, the communication centers. And so, all of a sudden in our office, we'll see kids, speak some of their first words to their parents, or like you said, we'll see kids that, redevelop tone in areas that have been, chronically low tone, because that area of the brain that works or that commands that part of the body all of a sudden starts to reactivate. And as we get improved brain activation, we get improved body function pretty much across the board. again, varying greatly from which areas of the brain are affected and what symptoms are showing up in the body. But language is a big one. Socialization, eye contact is a big one. Tone, decrease in spasticity, improved sleep. I mean, improved sleep is one of those things that I think a lot of pretty much anybody going in there seems to have
Yeah.
that benefit. So, but it's pretty miraculous. You know, to me, hyperbaric is just one of those things that's so simple. It's on the scale of different modalities that anyone could use. It's virtually one of the safest that you can use, and its level of effectiveness is so high. You know, to me, for so many of these cases, it just becomes like, why wouldn't we at least try to see, you know, what type of response, especially for a child, that they might have.
Yeah, my daughter actually she wouldn't make visual contact with people.
Ooh.
And HBOT is something that changed that tremendously. She'll look at you now and she'll smile. And actually, when we first started using, she would actually start talking for the first time in the chamber. And I've heard that with autism too, that it really helps with those areas. I
Right.
think a couple of my main questions are, I think a lot of people have a hard time starting out because their main question is do I need to seek a hard chamber, or is it okay to go to a chiropractor and seek lower pressure with a soft chamber? Because unfortunately there's just a lot of misconceptions about, is mild pressure as effective, or where should they start if they're looking?
So, yeah, again, it's going to vary somewhat, of course, but I try to explain it to most people like this. Um, right now, under normal, even in a child with any type of neurologic or brain trauma or any of those kinds of things, we're all still getting about as much oxygen as we could possibly absorb at every minute with every breath. If we don't have a very specific, heart or lung issue, basically when we're breathing, we're relatively fully saturated with oxygen. The little pulse oximeter they put on your finger when you go to the doctor. So, 96, 97, 98% saturated. So, even if we had, a green tank of oxygen, medical oxygen, and a mask, and we're breathing, you could only see maybe 1 or 2% increase in oxygen under normal amounts of pressure. So the thing that hyperbaric does, which I think is kind of, it's hyperbaric 101, it doesn't work because of oxygen as much as it works because of pressure. And as soon as you change the pressure in the environment that somebody's in, you basically drive oxygen into circulation at a much higher level than you can where you and I are right now under normal pressure, like sea level atmospheric pressure. So understanding that is to say, listen, to some degree, any pressure, so soft chambers, just speaking in broad terms, we'll use atmospheres as an example. So soft chambers, right now I'm at sea level, so that's 1 atmosphere, and a soft chamber goes to 1.3 atmospheres. So as soon as you add 1.1 atmospheres, you're going to increase the oxygen absorption. 1.2, you're going to increase it more. 1.3, 4, 5, and so on. So every fraction of an atmosphere, or PSI, however you want to look at it, that you're increasing pressure of the environment, you're increasing oxygen absorption. The other thing is that at certain pressures, particularly higher pressures, the body recognizes the fact that there's a great deal of pressure on our body. And so the body has almost like protective mechanisms, if you will, to vasoconstrict, to actually decrease some of the blood flow because it's registering a lot of pressure inside the body. So I bring that up to say, in America, a lot of times we think if a little bit of something is good, more has to be better, doesn't it? Just if this is good, then this is great. It's not like that. Mm-hmm. And in particular with brain issues, and especially brain issues with children, although I would say it's the same as, brain traumas or any neurologic issues, even in adults, the lower end of pressure seems to have a better result than the higher end of pressure. And so there obviously are exceptions to that concept, but for the most part, somewhere between 1.3, which is what a soft chamber will typically do, and 1.5 is really the sweet spot for almost all neurologic issues anyway. And so, yes, sometimes 1.5 might get there a little quicker. And so the hard chamber offers that ability to do that where the soft chamber may not. But if you actually look at the math for how we can determine how much oxygen exposure a person has, what you can quickly see is, yeah, you might have to do a few more minutes every session or a few more sessions over the course of time. But in most cases, you can get where you need to go with a soft chamber if you design the protocol properly to maybe make up for some of those differences. And so 100%, the soft chambers offer a tremendous benefit for a lot of these neurologic and brain conditions. I'm curious though, did you guys, do you do air only with Denise, or did you do air with a concentrator? How do you guys do that?
One thing I loved about your book is you said it's okay to dive with air, and on a lot, on a lot of forums, I hear people saying don't do it, there's no point. But me and Denise started off with just pressurized air, and we couldn't afford actually the air at first. And for 2 months, I dove with her. I cured my chronic migraines. She sat up. We saw the biggest improvements diving with just air. Yeah. Now, after a while, I did add the air. And I liked it, but now how do you feel about, is it okay to dive with just air, or is the oxygen needed?
Yeah, so that's why I brought it up, because that is something that I think comes up often. So I got into this, we've been doing hyperbaric for over 12 years, and I got into it because I blew a disc in my back, and I had a drop foot in my right foot for about 18 months after the injury. And the only thing that ended up fixing it was a hyperbaric chamber, and it happened to be a soft chamber, air only. Oh, okay. So I grew up in mild hyperbaric, air only, and to me that, there wasn't anything else at the time. And, we functioned like that for years, actually, even in the office as we were treating people. Now, without getting into all the details, I don't know how many of the details people really want in terms of, why one versus the other, but just to summarize it, at 1.3, so actually, let me take a step back. What we're talking about, in case you're not that familiar, is that you could use a hyperbaric chamber that's creating the pressure. And then because of pressure alone, with even regular air is 21% oxygen, always. And in a chamber, it's 21% oxygen, but because we're adding pressure, we could absorb a greater percentage of that oxygen. And what some people do is they add an oxygen concentrator, which could range from anywhere, instead of 21% oxygen, it could range anywhere from 86 to 96% oxygen. And now you're breathing enriched oxygen while you're in the chamber. So, a couple different things. In general, a 1.3 chamber air only is still going to increase your oxygen exposure somewhere between like 27 and 30% higher than what we're getting right now. And so that's nothing to ignore. That's a significant, whereas when you realize that even with a green tank of oxygen, like I was saying, you're looking at like 1 or 2% max. This is 27 to 30% more. It's a significant increase in oxygen exposure. But then when you add the concentrator, it's almost 3 times that. And so it is a big difference to add the concentrator, and that does help a lot of people. But it's not like using air only doesn't do something. It does tremendous, changes for people. I would attest to that all day long in my life and in the first few years of practice using it. And there's so many families like you, Christie, who, kind of started that way. And, you added it, and you probably wouldn't even, we don't know, right? If you had it initially, would something have changed faster or not? Or, it's hard to tell, but for sure, air only is very effective. Now, I do want to add a couple pieces to that, because I know for those that are aware of this conversation, but maybe have some of those questions or concerns, when you're doing air only, you have to realize that air is a mixture of other gases. So there's primarily nitrogen, but there's argon and other gases in there too. So when you're doing air only, you're exposing yourself not to just increase oxygen, you're increasing nitrogen and other things too. One of the concerns, or one of the conversations that comes up here, it goes back to scuba diving, and it's like, well, how long can I stay sort of underwater or, with pressure, air only, and my body's absorbing all this nitrogen. Is that safe? Is that a problem for us? How quickly do you have to decompress? All those kinds of things. And, the truth is around it, just to summarize that, is for the most part, these soft chambers are somewhere around 9 or 10 feet underwater equivalent. And you could basically be 10 feet underwater, air only, for hours and hours and hours. And yes, you are accumulating nitrogen, but not to a point where it's dangerous. And like always, when you're in a chamber coming out, the goal isn't to get out as fast as you can. The goal is to come out at a comfortable pace. And so as long as you're basically following some some pretty simple basic guidelines for, how quickly you're pressurizing, how quickly you're depressurizing, there's really no concern on the safety side of nitrogen absorption or any of those kinds of things. And maybe while I'm at it, let me just add, there's on the flip side of that, then there's, well, if I'm using enriched oxygen, is there safety issues in terms of, flammability is a question that I think comes up quite a bit. Would you say that's also true?
I think a lot of people will even get a soft chamber and they still think
they think the chamber itself, right? The thing is, it's hard because if you just Google hyperbaric, that one word is used to describe such a wide range of tools that, it can be confusing to not realize that there's a huge variety in what's out there and what all that means. So let's cover all that. So hyperbaric chamber at 1.3, actually it doesn't even matter what the pressure is. It could be at 1.3, it could be at 3.0, like some crazy high pressure. If you're using air to compress that chamber, the air we're breathing right now is 21% oxygen, and the air you'd be breathing at 1.3 is 21% oxygen, and the air you'd be breathing at 3.0 is 21% oxygen. So there is no greater risk of fire or any of those types of things in any 21% oxygen environment. It's literally impossible. So people think, you're like tripling and quadrupling oxygen absorption, which must mean that you're tripling and quadrupling oxygen in the chamber. But percentage wise, it's the same. And therefore, there are none of those types of safety concerns. Now, if you're using a concentrator, some people might argue now there is some increased risk. It's less than a fraction of a percent, and a few reasons. One is, until you really get to 100% oxygen, that's really where oxygen becomes a huge oxidizer. Next is the flow rate of these concentrators is pretty low. It's about 10 liters per minute. So it's not creating that much oxygen. And by the time you mix the oxygen coming out of the oxygen concentrator with the air inside the chamber, you're mixing virtually, 60 liters per minute of 21% oxygen with about 10 liters per minute of 95% oxygen. You're still at a net inside the chamber about 23 or 24%, which again negates any concern for any fire or safety or explosion type issues. I hope that helps.
Yeah, no, that helps. I want to get my viewers a chance to ask some questions, but speaking on some of the questions people have about the dangers, I think the number one concern I hear, and especially since my daughter has a brain injury and CP, is the seizure risk. If you could give some of our viewers just advice on, can it help seizures? Can it make it worse? Should I?
That's a good one, yeah. So
maybe consider mild pressure if there's a seizure condition present?
So there's a few pieces to that. And one is that if you use high pressure, high oxygen, there's a thing called oxygen toxicity. So that's like another sort of safety concern that people bring up a lot. Oxygen exposure is safe to a certain point, and then it becomes dangerous at some other point. In order for it to become dangerous, you're talking very high pressure. You're talking typically 100% oxygen at high pressure and for long periods of time, without taking breaks and things like this. And oxygen toxicity is known to create seizures. And so there is a thought out there that hyperbaric causes seizures because of oxygen toxicity. So just to put that in perspective, yes, that is true in that particular environment. In the high pressure, high oxygen toxic environment, you could cause a seizure. in mild pressure with lower percentages of oxygen, there is no research at all to support that that would create any type of increase in seizure activity. And in our clinically, what we see is that it often helps so many kids with seizure disorders. So I would say from our experience, it's been quite the opposite, especially when you lean on those more mild pressures with lower levels of oxygen. Now, if a child or an adult has epilepsy or some other version of a seizure disorder, they could have a seizure in the chamber, just like they could have a seizure on the couch or on the floor playing or in bed. But there's no reason, one, to think that it's dangerous. Especially with children, you would have an adult, right? You've done all the dives with Denise, right?
Yeah.
You would have an adult in the chamber with them that who knows how to care for the child. And there's no reason that, or there's no documented increase in seizure activity through mild pressure or mild oxygen.
That's great. While we're here, does anyone have a question that you're wanting us to answer right now? You can either tune into the video or there's a chat box on the side.
Someone here said from New Jersey, and her dad is thinking about using HBOT for her dad who has a trach, and is that a problem? So no. One, you can do so. Just for whatever reason, two weeks ago, we helped install 2 chambers for 2 people who are in some degree of a vegetative state with a trach. One is actually going to use a hard chamber because we are going to eventually go to higher pressures for totally different reasons that aren't part of this conversation. The other one's using a soft chamber like we normally would. And so one is you can just do soft chamber air only, in which case it's going to have no effect whatsoever, negative, positive, or whatever, in terms of, even having to manipulate or deal with anything related to the trach. The next is that, most people on a trach, they're already getting oxygen. You can certainly chime in there if this is a different story, but most folks are going to have some amount of oxygen on some regular basis. And often is the case, it's given through an oxygen concentrator at maybe 4 to 6 liters per minute. And there's an adapter to go from the concentrator right to the trach. And so in those cases, if we wanted to, we could do the exact same setup in the chamber with a different concentrator, but the same idea and that same adapter. And we can run 5, 6, 8 liters per minute through the trach the same way they may be getting, let's say, in bed. So hopefully that helps. I see another question. What are your thoughts on relatively healthy teens using HBOT? I was hoping my 14-year-old might use it to improve immune function. 100%. So, we have 2 hard chambers, and depending on the week, 2 or 3 soft chambers in the New Jersey office that we're running and treating people with. We have a few that we also rent or, help people purchase over time. And my office is about 2 miles from my house, and I still have a soft chamber in my house because it's just easier and more convenient to be there than I would treat myself in my office. I go in there for my issues, or Melissa goes in there for her, and we bring our kids in regularly. So I absolutely think there's a component of hyperbaric that's very healing because we have some type of issue and we're trying to recover from that issue. And then there's a portion of hyperbaric that's really just about healing from life. I mean, that's really all it's doing, is it's improving our capacity to recover and to heal. And so sometimes that's, from trauma in our life or stress in our life or, just time under tension on this planet. And sometimes it's because we have an autoimmune issue or a brain trauma or one of these things that we're really trying to heal from. So healthy people, I get a question a lot. Let's say the mom is going to go in the chamber with their child. We're trying to heal the TBI for the child, and the mom is concerned. Is that going to be not healthy for me to be going in with my child all the time? Isn't that too much for me? I have nothing wrong. There's no issue in terms of damage or trauma that way. And if anything, most moms report back like, hey, I had this or I had that. I didn't even realize, I didn't think that this would help, but I'm actually seeing improvement in that. So that's a pretty common phenomenon. A couple more. I already own a 5-liter concentrator. Can that be used with HBOT, or does it have to be a 10-liter? It needs to be a 10-liter, and it needs to be a very specific type of 10-liter. And the reason for that is that the pressure, most concentrators are meant to put out however much it could put out against atmospheric pressure. But inside the chamber, there's higher pressure inside pushing out against the machine. Therefore, the machine needs to generate 10 liters back against the pressure of the chamber. Therefore, there's really only 1 or 2 companies that make even a concentrator capable of that right now. But it is important that you get the right, if you're going to use a concentrator, it's not going to be dangerous, but you're probably going to break the other concentrator. So it is important that you have the right one. Are there complications if the patient is bedridden? Yes. Depending on the circumstances, again, so both of those patients that just happened to be talking about from 2 weeks ago, both of them are at home. They're both bedridden for different reasons and different scenarios, but both have Hoyer lifts. So if you have a Hoyer lift and a soft chamber, that works really, really well together. That's a great setup that would help that scenario. Christie, did you have more questions? I'm just kind of going down the list. But...
I think Fiona, when she asked about the protocol, I think a lot of people, when they get into this, I think money and travel is involved with children. I think another important topic to cover is some people have already done the initial 40 dives. Some people go to clinics. Some people have a home chamber. I understand that every case is different, but is there kind of a way you could tell people, are they in this for the long run? Are the benefits permanent? Can they just do 40 dives?
So, I mean, historically, if you look at a decent amount of the research that's out there, along with people who've been doing this a longer period of time, a lot of them have their protocol would tend to be, 40 hours in the office, right? At maybe a little bit higher, like the 1.5, and then taking a break. And then after the break, potentially looking into a rental or a purchase so that you can do more ongoing care at home. That's a pretty common approach that I hear about. Could you do all of that at home? Basically, yes. If a clinic was close enough and the funds were there to allow for a clinical experience, could there be some other improvements? In some cases, absolutely. In other cases, we don't know. What I think is that, and these are just round numbers, but if 40 hours is kind of like that number everybody hears about or reads about online, there's kind of like this magic number. It's basically like an arbitrary number that was, sort of picked on a lot of research that was done. And so it kind of just stuck that way. Though at 40 hours, a lot of really cool things happen, like improved, blood vessel regrowth, stem cell release, collagen release, brain-derived growth factor release. You're starting to get a totally, in the beginning, you're just getting more oxygen, which is great. If for some reason there was a lack of oxygen, like if there was an anoxic accident and all of a sudden now there's more oxygen in that minute, that's an amazing thing for that person. Longer term, you're looking for can the body heal to a degree that it's now self-perpetuating its ability to function without the need for the therapy, or certainly less of the therapy. And so, those longer sessions, those 20 hours, 40 hours, 60, 80, 100, 200 hours, that's where, some really amazing changes really happen inside the body. Now, 40 hours at 1.5, 100% oxygen. So higher pressure, higher oxygen, 40 hours, like that might be something I might do in the office for somebody. That's going to be closer to like about somewhere between 65 and 75 hours at home at 1.3 with a concentrator. So, I also try to let people know that the 40-hour mark, my opinion, is that the 40-hour mark was developed typically somewhere between 1.5 and 2 atmospheres. That if we want to create a similar protocol for home, that's a longer period of time. And I like the double sessions. I don't know, did you guys do double sessions, Christy, back when?
Was that two
Like
sessions a day?
like
Or?
one in the morning, one in the afternoon kind of thing?
We did, and
Yeah.
a lot of people ask that too. Should I dive once or twice a day?
Yeah.
But for the first 2 months, we almost dove daily for twice a day. We saw
Yeah.
no negative effects, but it really helped with a lot of anxiety I had from my daughter's brain injury, so I got to heal with her.
Right.
And I see someone did ask if they thought longer dive sessions were more effective. Do you find that diving twice a day is more effective than once?
So a lot of the research, and this is only new in the last probably 2 or 3 years, because it's some of the effects and benefits have to do with oxygen absorption, and some of them actually have to do with pressure changes. That we're going to find over the next few years that frequency outweighs duration. So, if you had to do 2 hours in a row because you just had to, versus you could do an hour in the morning, get out, and an hour in the afternoon, we're going to find that the double sessions are much more effective than the single. Even though it's the same theoretical dose of oxygen, it's a different amount of, in other words, instead of going up or actually going down, you're going down, staying for 2 hours and then coming back up, going down, staying for an hour, going back up, and then waiting a little while, then going back down, staying for an hour, going back up. More transitions of pressure are going to become much more we're going to see that they're going to be much more beneficial than just the amount of time. And so I'll typically recommend as a home protocol, instead of saying 40 hours, I'll say 75 hours. And I'll say as close to one 60-minute session twice a day, 4 to 5 hours apart, typically, at least, for the first 6 to 8 weeks. A protocol like that as an initial program is a really powerful one. I do recommend breaks after series of protocols. And the reason for that is, so back when they would say, 40 hours, but it had to be Monday through Friday, and you had to take 2 days off. So you could only do Monday through Friday, but you had to take Saturday and Sunday off because you have to rest and then start again on Monday. There's nothing, that's because the clinic was open Monday through Friday. It was closed on the weekends, and, so nobody was working. So we had to take that break. It's not for the patient's benefit. You could do 6 or 7 days a week, in that time if you want to. There's nothing to show that you need those breaks in those phases. But so much of what happens to our body is how much oxygen you're absorbing. Then it's the changes in pressure, but it's also when you take the oxygen back out of the body, because when you get out of the chamber, the oxygen starts leaving. And so really the break in between protocols has a lot to do with allowing your body to go back to, I'm saying sea level because that's where I'm from, but if you're from Colorado, it might be 5,800 feet, but going back to the pressure that your body is used to, and then just healing, letting the body do what it does from all of that accumulative, oxygen that it absorbed and the changes that have now begun. And there's a relative, when you're in the chamber, you're hyperoxic, you're getting more oxygen. When you come out of the chamber, even though you have more than you did when you started, you're becoming hypoxic, relatively hypoxic, and your body feels the loss of oxygen. And so a lot of the really important neurologic benefits that come from hyperbaric come when we get out more than they come from being in. And so for that reason, the frequency is important. And for that reason, those breaks after chunks, I think, is also important.
Okay, that's great to know because that's a question we hear a lot. Now, benefits that parents see, are those expected to be permanent, or is it maybe if we see benefits, we need to do another in a couple years?
So both, unfortunately in this moment, there's no test to say you have now exceeded or met the demand required for the maximum healing that you're going to get. So a few things. If the condition had a beginning and an end, as an example, like the trauma of CP or of a TBI, there was a moment of time that the trauma existed, and now there's just healing that needs to take place. Those would be more permanent changes. You shouldn't necessarily see sliding back. Now, there could be other issues, right? There's food sensitivities, there's other deficiencies. So all of a sudden you let, food sensitivity slide for a little while, you see a return of symptoms, that kind of a thing. But in terms of the real concrete healing, when it's a traumatic situation, typically you keep whatever you get. If it's a degenerative thing, like we treat a lot of dementia or MS or other autoimmune diseases, those have a tendency over time to degenerate further. And so ongoing care in those scenarios is much more important. The other thing I usually would say to people, if you start, here's where your symptoms are now, you start doing hyperbaric, you start to see an improvement, if you haven't plateaued in general and you're getting good improvements, I would keep going until you start to see it rounding out. That's when I would typically take that break, let things settle down for a little while, maybe implement some other strategies and therapies. Like you were saying initially, you start doing, this is what happens in so many cases, you start with kind of a lot of the state, type therapies with the PT and the OT, and you make a certain amount of progress and then things plateau. And then they're kind of like, well, so, here's where we are and that's just where we're at. So, now we need to learn how to adapt to, this is the, the pinnacle of what we should expect for recovery. Obviously you see that now that that's not true. And so, but you might say that, well, you can't do that therapy anymore because now we need to heal a little more. So we heal a little more and then we go back to that therapy and all of a sudden we get a jump in progress. Then that plateaus again so that we go back to more oxygen. So a lot of time, you're putting a few pieces together and again, there's no protocol for this. This is just stuff, we have to figure out as it's happening typically. But you try to say, how far can we take this? That seems like we're getting close. Now let's add this. How far can we take this? So many parents, you say, and listen, and believe me, we've worked with enough families that this is a huge challenge, I think, in almost all of our lives. But it's, I wasn't sure what to do. So, we did a gluten-free, we were going to do gluten and dairy-free, but, all my kid eats is gluten and dairy. So we did gluten and that didn't seem to do much. So we put gluten back in and then we took out dairy and that did a little bit, but it wasn't really enough. So we put that back in. And then I heard about neurofeedback. So we tried that. We made some progress. That was good. But he started to backslide a little bit. And then we tried hyperbaric, unfortunately, so many cases, it could be, and there are tests for things like this, but it could be gluten and dairy. And if we only do one or the other, we never actually see what the response would have been, right? Or if we take them out and we see a response, but it's not as much as we wanted to, and we put them back in and then do hyperbaric, the hyperbaric may not be as effective as it could be because those two things are creating an inflammatory response and an immune response that's not allowing the healing to occur the right way. So this is a really I'm getting a little off track but these are the challenges that I see in the clinic all the time. And these are the really hard, conversations to have with families and trying to determine, that's why if we could do a test, if I could do a test and be like, listen, gluten and dairy is actually not part of the problem, as an example, it's like, we could just check that off the list and move on, or if it is a problem, we need to deal with that because, that's going to be something that inhibits the progress. So, but in a lot of cases, I guess it's this multi-therapeutic approach. It's trying to combine for your family, for your child, or for your life. You're trying to combine what are the most important pieces for you and how do we get those all to come together in a way that's really meaningful from a healing standpoint.
Yeah, no, I think that's a great point to make. When we started HBOT, I didn't do as much of the real food brain diet as I do now, and it makes a huge difference in conjunction with the HBOT as well as the physical therapies that we do afterwards. We just saw so some people do start and they say, I didn't see as good as results as other people, but I do think the diet and the almost detox factors that you do either before or during. Do you think it's important to do that beforehand, or is it okay to start kind of during your?
In a perfect world, we would typically do some pretty detailed homework just to see, like, some of those underlying issues, right? It's like some of those like subacute infections, the molds, the Lymes, the toxicities, the heavy metals, uh, even just like the pesticides, the herbicides, all that kind of stuff. If you spend the time to do some really good homework before you go in, I think you can start to lay out a plan that you're not guessing. At least I think you could at least say, these are issues, these aren't issues. We need to focus on these, we don't need to focus on these. And that allows, I think, for people to go through a process just a little bit more linear. It's never perfect, obviously, and it's never completely linear. But I think if you spend the time to go through and figure some of those things out first, you'll get the most out of each step along the way. Now, there are times where, there are there's so many different issues that are all going on simultaneously, and symptom wise, it's very difficult to like narrow down or prioritize them because they're just so broad. Those cases, I might just start with oxygen anyway, because then it's like, listen, here's there's no way that's going to be bad. Here's oxygen. Let's see what the body can do with that. This starts to simmer down, this starts to simmer down, but these two don't. Okay, now we know where to focus, right? So, I try to make as much of a rational thought process through it as I can, but as you know, it's ever changing.
Yeah, no, I love that you combine all of them. For our viewers listening, how can they kind of reach out to you for some of the services you offer? And what do you offer for parents at your clinic?
So we have a whole wide range of things, like I was saying before. So, and we treat people locally, like in our actual clinic, and people, pre-COVID, people came to the office on a regular basis. They still, so we still have our in-person visits, but we do a ton, and we were before this also a ton of virtual type appointments. But we could be doing things like running blood work or saliva or urine tests. We do help a lot of people gain access. So like our big thing with Hyperbaric is helping people gain access to the therapy. So whether that means it's somebody who is local that could come to the clinic, great. If not, we do try to help people either have access to a clinic near them if we can find one, or to rent chambers to them, or if they're going to purchase a chamber, to help them purchase the chamber. So all of those things we can do, or just honestly, this is something Melissa and I are very passionate about. And so, even if it's just answering some questions that could help give somebody some guidance. I think Melissa, I don't know did Melissa share my email or no?
I believe it might have been before we were live.
Yeah. So if not, so it's Dr. Jason Saunders, DrJason SONNERS at hbotusa.com.
Okay.
So if you have any, if you want to send a few questions my way, and if I can help guide you in some way that's meaningful, I'd be happy to try to do that.
Okay, and I was sharing your book on my Facebook, but your book, Oxygen Under Pressure, also covers a lot of these questions and concerns.
Yeah, I wrote that book initially to help educate doctors on the therapy, because there's, such a misconception around everywhere. But I also tried to write it in a way where, I think just about anybody would understand the concepts and be able to digest the information, or if nothing else, certainly answer some of those, frequently asked questions that come up a bunch about this. There's a few more here. What benefit does 1.4 have over 1.3? The FDA limits to 1.3, but Oxygen Health sells a 1.4, and are teens prone to developing short-term myopia. So one consequence, if you will, of hyperbaric is potentially short-term myopia. But that almost never happens in soft chambers anyway. That's also a high pressure concern, much more so than a low pressure concern or a mild pressure concern. 1.3, just like I said, 1.1 offers value, 1.2 offers value, 1.3 offers value, 1.4 offers value, 1.5. They're all good, so there's some fraction of a percentage that 1.4 might offer you that 1.3 doesn't. How important is that? Again, you could, for these conversations, you could manipulate time and frequency and duration to get the same result that you would with a 1.4 rather than a 1.3. If you're getting a 1.4 in the US, it's not going to be, trying to think of the right word. It's certainly not FDA approved. That might mean things to some people and not mean things to other people. But there's certainly no recourse. If you have any issues with that chamber, you're probably unlikely to have any recourse to deal with that. There was another few. How it works with my 7-year-old boy has epilepsy. So I think we covered a little bit about that. I mean, you know, I'm not making, you know, I can't give everybody, you know, medical guidance, you know, on a call like this. But I would say just in broad terms that typically mild pressure with mild oxygen, mildly enriched oxygen, tends to be very healing for brains and tends to have a great effect on epilepsy. For epilepsy specifically, really for brain trauma across the board, we use a lot of ketosis or ketosis style food for the reasons of, you know, feeding the brain as much fat as we can, because there's a tremendous amount of research on that brains appreciate fat far more than they'll ever appreciate sugar. They run more effectively, they run more efficiently. There's tremendous amount more healing and decrease in inflammation. So, you know, we'll combine a keto style type diet. There's a varying amounts and ways to do that with hyperbaric oxygen, often with red light, and often also with a few different supplements. That was one of those questions I think that we were going to talk about too, right? So molecular hydrogen is something that we like to use a lot. CBD in so many of these cases is something that helps. If there is detoxification needs, there's too long of a list to go through, but, you know, supporting, you know, liver support and intestine support, certainly certain binders to make sure that you're absorbing those toxins and getting rid of them. But if I just had to pick a few, you know, the CoQ10 of the world works really well. Magnesium is usually something on that list. And then the molecular hydrogen and CBD, I think, are amazing. Not just blanket statements for everybody, but for certain, you know, keeping the conversation to more brain activity / brain healing. Those things tend to be pretty meaningful.
Yeah, I agree. We actually used all of those in the beginning too, and it really helped.
How long of a break should be taken between these series? Again, there are stated sort of like, it has to be like this, but I haven't seen any research to support any of it. The average is usually a 3-week break in between series of protocols. Can 1.3 have an impact on gut dysbiosis, or does that require higher pressure? Ultimately, it will absolutely have an effect on gut dysbiosis, depending on how much bacterial overgrowth and which bacteria they are. Higher pressure could have a meaningful effect on certain microbes. There's a huge antimicrobial effect of hyperbaric, but some of these infections like C. diff or H. pylori, you know, to really, if you weren't going to use traditional means and you were looking for hyperbaric to do most of the heavy lifting, in those scenarios, the higher pressure is more important and more meaningful. But in terms of probiotics in our gut, they love a mildly oxygen-rich environment. So the good guys, they thrive and they do really well in a hyper-oxygenated system. And most pathogens are anaerobic, which means most pathogens do not appreciate high pressure environments. So you'll absolutely see some shifting of your microbiome from using any type of pressure and oxygen levels. It just really depends on the extent of the issue and how much you're expecting hyperbaric to do versus other means like diet change, like supplements, like detox, like even potential traditional treatments like, you know, antifungals or antibiotics or things like that. I think I got through most of those on the list here. Anything else, Christie, that?
Oh, no, you answered all of my questions and so if anyone has a final question to put in.
Anybody else have anything that they want to share or ask? You can throw it in the chat box or unmute yourself and say it out loud. How about acute injuries or trauma as opposed to chronic? That's a great one. So again, unfortunately, it's kind of vague, but it depends on the extent and the amount of damage. So, certain non-healing wounds, but mostly because of the infections that persist or the lack of or the damage to the blood vessels over long periods of time. High pressure helps those folks a lot more. But an acute trauma, like I would still have considered like my back injury acute. We treat a lot of other neuropathies or acute injuries in our office, and we'll use more mild end, again, that 1.3 to 1.5 range pretty effectively for those cases. It does a great job reducing inflammation and swelling pretty quickly. So that works pretty well. Thoughts on post-concussion syndrome, 100%. And absolutely 1.3 in those scenarios anyway. Like even in our hard chambers start at 1.3 and go up to 2.4. And so if I had a post-concussion, especially an acute post-concussion, we're not doing more than 1.3 anyway. So even though they might go in a hard chamber, we're still only doing the same pressure we could do in a soft chamber on many of those cases. Can a soft chamber be used in a nursing home? This is hard. I get calls few every week for sure from, trauma centers or, brain rehab centers or nursing homes. And the families are noticing that the patients are plateauing in their, progress and healing. And so they start looking for alternatives. They find hyperbaric and then they find us, they give us a call. We are yet to find any private facility that will allow us to bring equipment in. If they don't have, typically what I have found is if they don't run it in there, they're not allowing it to be in there. Mm-hmm. So that's been a challenge that we've not been able to overcome. And in a lot of those cases, unfortunately, then we have to wait until the patient's released, if they're released from acute or long-term care, and then use that way. In some more like assisted living or even very assisted living places, we've been able to do that. But so there's sort of a cutoff with who in the private sector that way will allow things like this to be there and who won't. But it's a tough one. Now I think I got them all.
Yeah, no, and I just want to thank you again for your time today and educating some of the parents in my groups and anyone else. I see other people are saying thank you. I really appreciate it for one, so we can just educate people. It's a great therapy. It's safe. I love advocating it for children, especially, just because I've seen what it has done to my daughter's recovery, and she wouldn't be the same person today if it wasn't for a couple of people guiding us to start especially mild HBOT. So I'm really appreciative.
Yeah, no, like I said, it's my pleasure to share, and any time that we have to take a minute to just help these families, there's so much to navigate. There's everything traditional medicine that we're trying to navigate. There's trying to figure out our life and our lifestyle around these changes that are now occurring in our family and our life. And then we start looking for all these therapies. And I mean, I've been online. I see how many strong opinions there are and how, diverse they are and how, they all go in different directions and contradict one another. So if I could take a few minutes and help just sort of steer that a little bit, I'm always happy to do it.
Great.
Take care, everybody. And like I said, feel free if you want to contact me, absolutely feel free to do so.
Thank you.
Yeah, of course.